Hello, my name is Rolfo. I'm professor of medicine at the Ohio State University, director of the Division of Medical Oncology, and associate director for the Cancer Center in early phase clinical trials. My focus of interest is thoracic oncology and biomarkers, circulating biomarkers. So we discussed today in the highlights of the day different important data. I think the important in the lung cancer early detection or early screening and the tumor biology I selected 4 abstracts. The first one was the abstract related to the radon, and that was the radon exposure and the TME impact that we have. So what they were doing is trying to study, the group of Laura Mesquita was trying to study the impact of the radon and the smoking together in analysis of the TME. They found that there are some interesting findings there that we can recently actually trying to find for never smokers an opportunity to screening following this impact even in T-cells and the immune system. The second abstract that I analyzed was the air pollution and the lung cancer. So that was a very interesting analysis that they were putting together data of genomics data and risk, is a genomic risk and the air pollution. And there was a nice interaction that is also opening the door for a screening of patients that are never a smoker as well. The other abstract that I was studying or was presented today about the highlights of the day before was the biology. One is trying to explain the organotropies to the brain. And a very interesting study, they were looking for biopsies in the brain and the lung primary tumor and in other metastatic sites like lymph nodes, and doing single cell analysis, RNA, DNA, very interesting data on how the alterations that we can find in the primary tumor maybe were there before that they arrive to the brain. There are differences between the brain genomic profiling and a microenvironment compared with the primary tumor and the metastatic side. So this is also a very interesting way to demonstrate the clonal heterogeneity and the evolution of the tumors, how we maybe can prevent these brain metastasis organotropies. And the last one was the vaccine there was a design of vaccine in animal models that is related to the pneumonitis. Pneumonitis is a problem because we know that it's one of the side effects that we can have with immune checkpoint inhibitors, and the use of steroids is also reducing the efficacy. So having a solution there is very important. This design was taking in consideration different characteristics, including the animal model of this vaccine that is trying to reduce the immune pneumonitis and boosting the immune system. Obviously, very preclinical data, but open the door for a very good opportunities for our patients in case that this is successful.